Hello guys, today our topic is ventricular septal defect. You know that it is congenital asymptotic heart defect, or we can say it is hole between lower heart chambers like right ventricle and left ventricle. There are four common types of ventricular septal defect. It is perimembranous defect, trabecular, subpulmonary and inlet defect. In next picture you can see localization of this defect. For example, perimembranous defect is located in the membranous septum adjacent to the tricuspid valve, and trabecular muscular are completely surrounded by the muscular tissue and may occur anywhere in the septum. Subpulmonary outlet in the ventricular septum immediately under the pulmonary valve, and inlet defects are bordered superiorly by the tricuspid annulus and are located posterior to the membranous septum. Okay guys, what about pathophysiology? We have to left to right shunt. It means that blood goes from the high blood pressure to low blood pressure side. So because of it, increased pulmonary blood flow, increased pulmonary hypertension, pulmonary blood pressure in the right side, in right ventricle, accumulation of blood, overload of blood volume, overload of blood pressure. Because of it happens dilation of right ventricle, then hypertrophy. So in right ventricle you see that blood pressure is increases. Yes, because of it shunt is converted to the right to left shunt, and it leads to the Eisenmenger syndrome. It is two shunt syndrome, and also it contains pulmonary hypertension. Because of right to left shunt, we have overload of blood volume, high blood pressure in left ventricle. So at second place, also it can happen dilation of left ventricle, which can lead to the hypertrophy of left ventricle. What about the clinical manifestation? It depends on the size of defect. If it is small defect, so it can be asymptomatic. Asymptomatic, so no symptoms. Also, we can see if it is large defect, we can see which symptoms. It can be difficulty breathing, shortness of breath, fatigue after feeding, some feeding problems. Feeding time can be enlarged, prolonged. So because of pulmonary hypertension, because of overload in right side, also can be occur some respiratory infections, and also weight gain, lost weight gain, poor physical development can be happen. About the diagnosis, we can diagnose by the ECG, echocardiography and chest x-ray. Of course, it depends also on the size of defect. If it is large defect, so you can see on ECG hypertrophy of chambers, right ventricular chamber, and also sometimes left ventricular hypertrophy. On echocardiography, you can check characteristics of the defect, like you can determine size and also size, degree, severity of the defect. So sometimes you can use also cardiac catheterization. Cardiac catheterization you can use for the checking conditions in pulmonary artery, because we have pulmonary hypertension in this case also. In chest x-ray, of course, you can see cardiomegaly. About the treatment, if it is small defect, it can close spontaneously. If it is large defect, so in this case you should use surgical repair, also medicines before surgical repair, which can help to close this defect. Which medicines? It is like diuretics, digoxin, ACE inhibitors may be useful to control symptoms of heart failure, and we can use surgical repair by the 3 to 4 years of age.